to read a few excerpts from your book.
Yeah, so once again, I want to thank everyone for coming. I really want to thank Dr. Enchi and Dr. Jackson, I think, for your excellent reviews. Dr. Enchi, hey, I need to borrow those slides, man. They are really good. So I need it for my next presentation. Thank you all so much. So right now, I'm going to just share a few snippets from the book, just for you to get a feel for the style and the wording and the grammar as well. Okay, so the world is facing an epidemic of chronic diseases: diabetes, asthma, heart disease, stroke, chronic respiratory disease, hypertension, fatty liver disease, kidney disease, and cancer, among others. Combined, these diseases kill more than 36 million people per year. At the root cause of these diseases is overweight and obesity. We can modify our diet behavior from the typical Western diet and sedentary lifestyle to combat obesity and chronic diseases. A typical Western diet includes pizza, fries, burgers, sodas, and cookies. These foods are palatable and high in refined sugars, refined flour, preservatives, additives, pesticides, hormones, saturated fats, animal protein, and processed meat. One slice of pizza contains as much as 2/3 of the daily recommended amount of saturated fat. Long-term consumption of these combined foods promotes chronic diseases and weakens the immune system. Unfortunately, we consume less of the healthy foods, such as fruits, vegetables, whole grains, and nuts, which have the likelihood of reducing the risk of chronic diseases and boosting our immune function. Why should we reduce our intake of red meat, particularly red meat from grocery stores, which is typically treated with sodium nitrite or sodium nitrate to prevent the growth of bacteria and spoilage, and also add color and flavor and for longer shelf life? However, when meat containing nitrites or nitrates is cooked at high temperatures, such as on a grill, the nitrite and nitrates can be converted to compound known as nitrosamines. These are potential carcinogens or cancer-causing agents. The World Health Organization and International Agency for Research on Cancer have declared processed meat a potential human carcinogen and red meat a suspected carcinogen. As we know that processed meat is considered carcinogenic, the fact that grocery stores can continue to sell it defies simple understanding. We naturally like sugar, but surprisingly, there is no nutritional or physiological benefits from consuming sugars, aside from providing energy. We may gain some nutritional benefits, such as fiber, from consuming raw, natural, and brown sugars, whereas refined white sugars and the artificial sugars that are pervasive on the market have no fiber and produces only empty calories because all the essential nutrients are removed from them. Yet, sugars are naturally, readily abundant in our food, and excessive consumption of sugar is significantly associated with risk to diabetes, obesity, and other chronic diseases. A particularly harmful sugar to our health is the high fructose corn syrup. High fructose corn syrup was introduced into the US food industry in 1975 during the tenure of President Richard Nixon. High fructose corn syrup has become the preferred sweetener in a variety of foods, including cereal, cookies, soda, fruit juices, marmalade, and many other processed foods. High fructose corn syrup consumption accounts for a significant proportion of increased caloric intake and is associated with insulin resistance, obesity, type 2 diabetes, non-alcoholic fatty liver disease, elevated uric acid level, and hypertension, increased blood pressure, particularly in adolescents and young adults. High fructose corn syrup increases oxidative stress, inflammation, renal diseases, cardiovascular disease, Alzheimer's, rheumatoid arthritis, and the list goes on. High fructose corn syrup is pervasive in our diet and condiments, such as tomato ketchup, relish, barbecue sauce, salad dressing, pancake syrup, and other dairy-based products. High fructose corn syrup is also heavily used in making carbonated beverages, as well as for the gelling of jam and marmalade. Unless you consume only whole and processed foods, you are bound to have added sugars in your daily diet. We must therefore avoid these 3 S's for good health: saturated fats, sugars, and salt. Benefits of healthy diet. A clinical trial was carried out by the Lyon Diet Health Heart Study to investigate if the Mediterranean style diet may reduce the incidence of heart attack, of cardiovascular complications after heart attack. The intervention participants followed a Mediterranean style diet that included plant-rich foods, vegetables, fruits, and fish, but no meat. The results showed a substantial decrease in coronary event, and the protective effect of the Mediterranean diet was effective up to 4 years after the first incident of heart attack, compared to the control individuals who were on the Western style diet. Ms. Tracy Brown, the CEO of the American Diabetes Association, chronicled her own experience reversing her own type 2 diabetes through dietary intervention. Having lived with diabetes for 16 years, she claimed success in managing her type 2 diabetes by mindfully avoiding sugars and processed carbohydrates. As a result, she has stopped taking all her insulin and 3 other medications. Her testimony underscores the importance of a low carbohydrate diet for diabetes. And the benefits of healthy diets have also been reported for mental health. One study carried out to assess the role of diet and mental health in college students found that sticking to healthy diets of fruits, vegetables, and complex carbohydrates, as well as whole grains for as little as 3 months, improved depressive symptoms in college-age young adults. In this study, it was demonstrated that cutting down on processed foods and increasing fruits and vegetables, as well as fish, improved depressive symptoms. The control group used in the study, who have depressive symptoms but did not change their diet, reported no change in their depressive symptoms. Modern day advances in transportation means that, unlike our ancestors who had to walk and run several miles per day to get food from their hunting and gathering era, we do not have to do much to obtain food or accomplish work. As a result, many of us live sedentary lifestyles, in that our jobs do not require much physical effort. We drive or use public transport to commute back and forth to work. And when we are done with work, our lack of activity continues, typically in leisure time setting. Leisure sitting or sedentary lifestyle or lack of physical exercise contributes to 300,000 preventable deaths each year in the United States alone. Through chronic diseases, including obesity, heart disease, and cancer. The phrase, sitting is the new smoking, underscores the observation that sedentary lifestyle is associated with many chronic diseases that were traditionally linked to tobacco smoke. If sitting is the new smoking, how do we quit? We must find sustainable ways to incorporate physical exercise throughout the working day and week, even during this COVID-19 pandemic, to reduce our risk to the following chronic diseases: diabetes, cancer of the breast and colon, hypertension, depression, osteoporosis, dementia, chronic artery disease, and all causes of heart disease-related deaths. There are lifetime benefits of at least 30 minutes of moderate physical exercise 5 days per week. Yet observations suggest that the average person in most westernized societies spend the last 10 years of their life with some serious health condition. The question we must ask ourselves is whether we want to spend the last 10 years of our lives in sickness or be productive at all stages of life. Any level of physical exercise matters for the health span and our lifespan. We can change our lifestyle by increasing exercise to stay healthy and age well. We can grow old with vitality, not sickness. For lifestyle interventions, real foods and whole foods are much better than processed foods. The focus is being able to stick to healthy diets and home-prepared meals. Almost anything is better than our modern Western dietary habits. Fruits and vegetables reduce the risk of heart attack, whereas taking vitamin supplements produces no reduction. We cannot fool Mother Nature. Lifestyle dietary interventions is better than drugs. We are in control of what we buy, and we must begin to choose healthy foods, regardless of dietary preference. The overwhelming evidence supports plant-based diets or the Mediterranean type diet as best for good health. For the first time in thousands of years, we have created this bizarre condition whereby we are constantly in excess caloric energy because we consume too much food and we consume the wrong kinds of foods. We are consuming high caloric, energy dense foods more than our ancestors who struggled to get enough food. To maintain a healthy weight, we must be conscious about our caloric intake and expenditure, bearing in mind that various factors such as genetics, gender, age, influences how the body utilizes energy from foods. We must get back to basics and eat the foods that our ancestors ate. Human beings have a plan for good health. A diet rich in complex carbohydrates, fruits, and vegetables with little or animal foods. Some amount of sunshine and lots of exercises. This works and is good for our well-being. Thank you.